You notice it at the end of the day. If your shoes feel tighter, your socks leave a deep ring around your ankles. Maybe your feet look puffier than they used to. Maybe one ankle looks larger than the other. And because it happens gradually, it is easy to shrug it off and say, well, I'm over 60 now. I guess this is just part of getting older. But swollen ankles after 60 deserve a little more attention than that. They are often not an emergency. They are often not a sign of something terrible. Sometimes the cause is as simple as sitting too long, standing too long, warm weather, or eating more salt than usual. But swollen ankles can also be one of those quiet body signals that points to something deeper: circulation, medications, heart function, kidney function, vein health, blood sugar, or inflammation. So the goal is not to panic. The goal is to notice the pattern. Because when it comes to swelling, the pattern often matters as much as the swelling itself. This video is for education only and cannot tell you what is causing your swelling. But it can help you understand what your body may be trying to tell you, what details are worth paying attention to. And when it is time to talk with a qualified healthcare professional, swollen ankles are confusing because the same symptom can come from many different places. Your ankles sit at the lowest part of your body for much of the day. When extra fluid collects in the tissues, gravity tends to pull that fluid downward. That is why swelling often shows up first in the feet, ankles, and lower legs. Some people notice it after a long car ride. Some notice it after sitting in a chair for hours. Some notice it after standing in the kitchen, working in the yard, or walking around on a hot day. For others, the swelling seems to appear every evening, almost like clockwork. That kind of swelling is often called edema, which simply means fluid buildup in the tissues. But edema is not the full answer. It is only the description. The more important question is, why is that fluid building up? One of the biggest mistakes many people make is assuming swollen ankles are always just normal aging. It is true that swelling can become more common with age. Veins may not move blood as efficiently as they once did. The calf muscles may not pump fluid upward as strongly if a person is walking less. Many adults over 60 also take several medications, and some of those medications can contribute to swelling. But common after 60 does not mean ignore it. A better way to think about swollen ankles is this: your body is giving you information. Not a diagnosis, but information. Is the swelling in one ankle or both? Is it sudden or gradual? Does it happen only at night? Does it improve by morning? Is it painful? Is the skin warm, red, shiny, or tight? Did it begin after a new medication? Does it happen along with shortness of breath, chest discomfort, dizziness, or unusual fatigue? Those details matter. One of the most common reasons ankles swell is related to circulation in the legs. Your veins have a hard job. They have to move blood from your legs back up toward your heart against gravity. Inside those veins are tiny valves that help keep blood moving in the right direction. When those valves do not work as well, blood and fluid can begin to pool in the lower legs. This can lead to swelling around the ankles, a heavy feeling in the legs, aching, visible veins, or discomfort that gets worse after long periods of standing or sitting. For many people, this type of swelling is more noticeable later in the day. It may feel better after resting or raising the legs. That does not prove the cause, but it gives your doctor useful clues. This is also why movement matters. Your calf muscles act like a natural pump. Every time you walk, flex your feet, or move your ankles, those muscles help push blood and fluid upward. But when you sit still for hours, that pump is barely working. That does not mean you need intense exercise. Even short walks, gentle ankle circles, or standing up for a few minutes can support circulation if your doctor has not limited your activity. Another important possibility is medication. This is especially relevant after 60, because many people are taking more than one prescription, plus over-the-counter medicines, pain relievers, or supplements. Some medications can sometimes be linked to swelling in the legs or ankles. These may include certain blood pressure medications, anti-inflammatory pain relievers, steroids, hormone-related medications, and some antidepressants. But this is where safety matters. If swelling started after a new medication, a dose change, or a new over-the-counter pain reliever, that is worth asking your doctor or pharmacist about. It may be connected. It may not be, but it should be reviewed by someone who understands your full medical history. What you should not do is stop a prescription on your own. Do not stop a blood pressure medication, heart medication, diabetes medication, blood thinner, or any prescribed drug because you suspect it might be causing swelling. The risk of stopping suddenly can be much greater than the swelling itself. Medication decisions should be made with a qualified healthcare professional. Now, let's talk about the concern many people have in the back of their mind: the heart. Swollen ankles can sometimes be related to heart function, especially when the heart is not pumping as effectively as the body needs. When that happens, fluid may back up and collect in the legs, ankles, feet, abdomen, or other areas. But swollen ankles alone do not mean heart failure. Many things can cause ankle swelling. The concern rises when swelling appears with other symptoms, such as shortness of breath, unusual fatigue, rapid weight gain from fluid, needing to sleep propped up, or feeling breathless when lying flat. That combination is different from mild swelling after a long day. If your ankles are swollen and you are also having chest pain, trouble breathing, fainting, coughing, blood, or severe dizziness, that is not something to watch for a few more days. That needs urgent medical attention. Kidney function is another part of the story. Your kidneys help remove extra fluid and salt from the body. When they are not filtering well, fluid can build up. That swelling may appear in the feet, ankles, legs, hands, or face. This does not mean ankle swelling automatically points to kidney disease. It does mean swelling is worth taking seriously if you already have high blood pressure, diabetes, known kidney problems, or abnormal kidney tests in the past. Kidney problems can be quiet for a long time. A person may not feel obvious pain. So if swelling is new, persistent, or worsening, it is reasonable to ask your doctor whether kidney function, urine protein, blood pressure, and blood sugar should be reviewed. The liver can also affect fluid balance. Certain liver problems can change blood proteins and pressure inside blood vessels, allowing fluid to leak into tissues more easily. Again, this is not the explanation for every swollen ankle. But it is one reason doctors look at the whole person, not just the feet. Blood sugar also deserves attention, especially for people with diabetes or prediabetes. Diabetes can affect the nerves and blood flow in the feet. When nerves are damaged, a person may not feel a cut, blister, sore, or pressure injury. Reduced blood flow can also make healing more difficult. That means swelling in the feet or ankles can become more important if it comes with redness, warmth, numbness, sores, blisters, skin changes, or slow healing. If you have diabetes, do not treat your feet as an afterthought. Look at them regularly. Notice color changes, warm spots, cuts, cracks, or wounds. If something looks new or is not healing, bring it to a healthcare professional's attention. There is another pattern that should never be brushed aside: sudden swelling in one leg. One-sided swelling can happen for several reasons, including injury or infection. But one serious possibility doctors consider is a blood clot in a deep vein, sometimes called deep vein thrombosis or DVT. A clot may cause swelling in one leg, often with pain, tenderness, warmth, redness, or discoloration. This can be more concerning after surgery, hospitalization, long travel, reduced mobility, injury, or certain medical conditions. The reason this matters is that a clot can sometimes travel to the lungs, which can become a medical emergency. So if one leg suddenly becomes swollen, especially if it is painful, warm, red, or tender, seek medical care promptly. And if swelling comes with sudden trouble breathing, chest pain, coughing, blood, fainting, or a fast or irregular heartbeat, seek emergency help. This is not meant to frighten you. It is meant to help you separate something to monitor from something to act on. Another possible cause is lymphedema. Lymphedema happens when lymph fluid does not drain properly. It can occur after cancer treatment, lymph node removal, radiation, infection, injury, or other damage to the lymphatic system. This type of swelling may feel persistent. The limb may feel heavy, tight, or full. Over time, the skin may change. In earlier stages, swelling may improve with elevation, but later it can become harder to manage. That is why repeated or persistent swelling deserves a professional evaluation. The sooner the cause is understood, the better the plan can be. So, what should you actually pay attention to? Start with whether the swelling is on one side or both. Both ankle swelling may be related to fluid balance, vein problems, medications, long sitting, long standing, heart issues, kidney issues, liver issues, or general circulation patterns. One-sided swelling needs closer attention, especially if it is sudden, painful, red, warm, or unexplained. Then notice the timing. Does it appear after you have been sitting for hours? After standing? After salty foods? After travel? In hot weather? Does it improve overnight? Is it worse every evening? Did it start after a medication change? These are not small details. They are exactly the kind of details that can help your doctor make sense of what is happening. Next, pay attention to the skin. Is the skin tight or shiny? Is it warm or red? Is it pale or cool? Are there sores, blisters, cracks, or wounds? If you press gently on the swollen area, does it leave a dent for a few seconds? You do not need to diagnose these signs yourself. Just notice them. Take a picture if the swelling changes throughout the day. Write down when it happens. This can make a medical visit much more useful. Also, notice what comes with the swelling. Swelling with mild heaviness after sitting all day is one situation. Swelling with shortness of breath, chest pain, fainting, fever, severe pain, confusion, or sudden weakness is a different situation. That is the difference between calm awareness and dangerous delay. Now, let's talk about practical habits. These are not cures. They are not a substitute for medical care. But for many people, they are reasonable steps to discuss or use as part of general health awareness. If your healthcare provider has not restricted your movement, avoid sitting still for long stretches. Stand up, walk a little, flex your ankles, or move your feet during the day. Small movement breaks can support circulation. If swelling seems related to gravity or long sitting, raising the legs may help some people. The key is to see it as support, not a solution for every cause. If swelling is new, painful, worsening, or linked with other symptoms, elevation is not a replacement for medical evaluation. Salt intake is another area worth reviewing. Too much sodium can contribute to fluid retention in some people, especially those with high blood pressure, heart concerns, or kidney concerns. But diet changes should fit your medical situation, so it is wise to ask your doctor what level of sodium makes sense for you. Compression stockings can help some people, especially with certain vein-related swelling. But they are not automatically right for everyone. The pressure, size, and fit matter. And if you have diabetes, poor circulation, skin wounds, or heart-related swelling, ask a healthcare professional before using them. Also, be honest about supplements and over-the-counter medicines. Many people tell their doctor about prescriptions, but forget to mention pain relievers, herbal products, joint supplements, sleep aids, vitamins, and minerals. But these can matter, especially when mixed with prescription medications. A good rule is simple. Bring a full list of everything you take to your doctor or pharmacist. Not just the prescription bottles, everything. One of the most helpful things you can do is track the swelling for a few days. Write down when it appears. Is it one ankle or both? Does it improve by morning? Did you sit for a long time? Did you travel? Did you eat a salty meal? Did you recently start or change a medication? You feel short of breath, tired, dizzy, or have pain? This turns a vague complaint into a clear pattern, and clear patterns help doctors. So, when should you talk to a doctor? Talk to a qualified healthcare professional if swelling is new, persistent, worsening, painful, or interfering with walking or daily life. Also, talk to your doctor if you have heart disease, kidney disease, liver disease, diabetes, high blood pressure, or if the swelling began after a medication change. Seek medical care promptly if one leg becomes swollen for no clear reason, especially if it is painful, red, warm, or tender. And seek urgent or emergency care if swelling comes with chest pain, shortness of breath, fainting, coughing, blood, sudden severe dizziness, sudden weakness, or confusion. The main lesson is this: swollen ankles after 60 are not something to fear, but they are something to respect. Sometimes they are connected to simple daily factors: gravity, heat, sitting, standing, salt, or reduced movement. Sometimes they point toward vein problems, medication effects, blood sugar issues, or fluid balance. And sometimes they can be part of a larger signal involving the heart, kidneys, liver, lymph system, circulation, or a blood clot. You do not need to assume the worst, but you also do not need to dismiss your body's signals just because you are older. After 60, one of the smartest things you can do is pay attention early, notice patterns, and ask better questions, because your body often whispers before it shouts. And swollen ankles may be one of those whispers. If you found this helpful, subscribe for more.com. Clear explanations about health after 60 body signals, circulation, blood sugar, medications, supplements, and the changes worth noticing before they become harder to manage.